Hi, welcome to another video from Dr. Peter Carr, that's me. Kenmore chiropractor at Dynamic Chiropractic Clinic. A lot of our patients come in with this issue that I see now. I can't take my eyes off of it now. So when you come in and I identify it, I thought I'd give you as much information as I possibly can. This is a quick video to describe what happens when we use the iliopsoas musculature to hold our low back together. Iliopsoas is just three muscle groups. One is the iliacus, which runs inside of our pelvis. The psoas major and psoas minor. They all attach. Well, all the psoas attach to the front side of the lumbar vertebrae and to the discs at each level, and the iliacus attaches to the crest on the inside of our pelvis and runs down to our femur. And so the two muscles together are very compressive. And so when I start to talk to patients about it, it's like holding four oranges together. It's absolutely possible. Well, maybe it should be five. I don't even know if I can do five. Hold on a second. Oh, I don't know that I can do five. So, here, I'll try it. Okay, so imagine these are your lumbar vertebra. Oh, I did it. So the goal would be to hold these together in compression. And I can't do it. I can only do four. I think that's my record right now. So I can hold four of these together in compression. And you can do it for a long period of time. In fact, it's relatively stable as long as I don't move it. But if the top vertebra moves, or if it starts to pull out into this extension posture, which is all it can do in the lumbar spine, it will start to fail. And so if we keep this pressure here and we start to squeeze down, you can see how it's going to squash down that soft tissue all the way through the oranges, the discs, essentially, is what it'll cause problems with. And that's what I end up seeing with patients, is I'll see that they'll get disc injuries, or they'll get stenosis, where the hole in the back of the vertebra starts to squeeze down. And when the hole in the back starts to squeeze down, it will cause problems in the nerve that comes in the back. And at that point, there's nothing else we can do other than go in and do a surgery to try and clean out that space. As a chiropractor, what do I teach my patients? I try and teach them how to stretch the psoas. And so instead of having these guys being here and pulling down on top of one another like this, what we try and do is de-emphasize the psoas so that they can open up. And we start to use the muscles on the outside of the core, namely the diaphragm, the Kegel groups, and the transverse abdominis, or the obliques. So when we go through how a treatment protocol goes with my patients, what I typically do is I put together a program where we start to work the top part of the core, the bottom part of the core, and the side parts here, right? We'll often see patients that look like this, that have a big belly in the front, like burp, like that, because they're constantly being extended by that psoas. And so how does a chiropractic adjustment work? Well, we don't adjust patients into extension like this when they have this problem. We do the exact opposite. We bring them into this flexion position. And so why am I using a bear? Because this is the adjustable bear. And so I've also invented a new thing here called the adjustable. You can see he's adorable. But you can see how we often will do this. We'll adjust these for patients so they can see what's going on. And so for patients like you, when I describe this kind of problem, we're going to be giving you extension or traction exercises to stretch the psoas. We're going to teach you how to do it in all three dimensions, so you're not only doing it in extension, but you're doing a rotation, and you're doing it in lateral flexion, so you're bending off to the side. So we get all three axes of rotation. So extension, rotation, lateral flexion, that's how we stretch that psoas in there. And so how long does it take to get that change? About 16 weeks. And I usually recommend it 16 times a day to get the stretch done. Those exercises are on my website somewhere else. But we need to see that change first before we can start to really incorporate strength at the top part of the core, the bottom part of the core, and the outside of the core. It's difficult for patients to grab onto this because they've had it for years and years. Oftentimes, by the time they come see me, they see the symptoms, but they don't see the pain or problems that associate with it, and so it hasn't affected their lives yet. But once it does, it's almost too late. So it's one of those things where we like to think a pound of cure is nowhere near worth what a gram of prevention would be. And so if someone identifies this, I like to think of it in my mind as the canary in the coal mine, where it's a harbinger of ill will, and if we don't get it taken care of, we're going to have some major problems down the road. So I'm hoping that a little bit of this kind of fun analysis has helped you guys out so that you can see what's going on. We'll talk about it in my office, and if you have any questions, don't hesitate to call us at 206-343-3325, or look up the rest of these things on our website, www.dynamicclinic.com. Thank you very much for your time. We'll talk to you soon.